But I think there's a space that needs to happen that is a bit of a middle ground between healthcare as we kind of know it now and the dispensary experience, which is a bit more like a clinical, like a clinic model of dispensary that ideally would also incorporate mind, body, and other aspects of wellness. Whether it's essential oils therapy or other herbs alongside cannabis, just something that allows people to find where their condition needs to be treated on the spectrum, and then applying the right thing and moving them toward fewer and fewer inputs where they're achieving homeostasis. I think that wellness clinic model that incorporates cannabis in the right way, in a framework of as whole plant as possible.
You've just met Doug Reil, and you're listening to the LabAroma podcast with me, your host, Colleen Quinn. At LabAroma, we believe the secret to truly effective and therapeutic plant medicine is by understanding our plant science and backing that up with evidence. And there is no better man to have a conversation with when it comes to the need for evidence. Doug Reil is a beautiful soul and a fascinating man. You will learn inside this episode about his personal, very young experience of medical disease personally, and his experience in the world of medical publishing. The big thing that we dive into today is his work with CannaKeys. Doug is the co-founder and CEO of CannaKeys, whose mission is to empower patients, medical professionals, caregivers, and give the industry on a whole a tool to maximise the effectiveness of cannabis therapeutics, while also creating agency with regard to their applications. This tool and this work is something that our industry has needed for so long, and Doug and Ove, his partner, have done an amazing job with CannaKeys. But what's so amazing about Doug's story is how he got here and his experience in this world, especially his 35-year career in publishing within the medical space. His story is fascinating. I love that he has taken such an adverse situation as a young man and turned it into his life work in a very, very positive way for the benefit of us. It's a beautiful story, and Doug delivers it with such grace. Jump in and enjoy learning more about Doug and CannaKeys. So Doug, thank you so much for doing the LabAroma podcast with me. I'm delighted to have you here.
Fantastic. Thank you. It's great to be here, Colleen.
So Doug, I want to get to CannaKeys and I want to talk about that. But firstly, I want to understand how you got there. So you started your career in publishing. So how did you start in publishing, and then what led you into CannaKeys? Because they're quite different. Well, I feel they're quite different. Maybe it was a natural move.
Yeah, well, I think there's definitely a relationship between the nature of what we do at CannaKeys and the publishing work and where I came from, because there's a strong educational side to what we do at CannaKeys. And so I got into publishing. I'd always loved books, and I had done internships at libraries and things in college. And as I came out of school, I became aware of an opportunity at a book distributor nearby as I was a bit casting around for what I wanted to do. And so I started at the book distributor wholesaler and got exposed to all these incredible books. And it was a bit of an alternative wholesaler distributor. So it wasn't exactly mainstream books. It was a lot of alternatives, titles in various different subcultures, and a lot of them were health related. And I had already been on the healing path for myself with my Crohn's disease, had manifested quite early at the age of 10, 11 years old. And so I had already been exposed and started to look for some alternatives. So being exposed to all these titles that were very well curated for the distributor that it was, really piqued my curiosity, and it kind of expanded my horizons as far as the possibilities for different perspectives, particularly not only around health, but the mind body aspects of our existence and their importance, and how that underpins a certain outlook, and some would say spirituality and spiritual outlook at life. So yeah, I was very intrigued by that, and kind of went all in with the book trade and wanted to learn everything about it. And kind of that followed that through line of curiosity, particularly around alternative and maybe edgy topics, or alternatives to health, alternatives to different perspectives. And that has followed through with the nature of the publishing I've been doing. And so over time, the my health and the work that I've been doing in publishing, there was kind of close parallels to that.
Yeah. Okay, so that makes lots of sense. Can we talk about the Crohn's disease for a while? That's incredibly young. I didn't realize, I've never heard of anyone to start to get Crohn's disease that young. Is that normal? And how did you maneuver that as a, coming into your adolescent years?
Yeah, it was a tricky time. It was very unusual back then, extremely unusual. And back then, people would be like, "What's Crohn's disease?" when they would learn what my condition was. And now, when I share that I have Crohn's disease, invariably, nearly 100% of the time, people will say, "Oh, I know someone or someone in my family has it." So the prevalence of the condition has increased dramatically. And to your question about how I managed it, I learned how to be very pragmatic. It was challenging, certainly, especially, I mean, getting the diagnosis was probably as bad as the disease, trying all these different tests and things. That was very challenging and gave me a somewhat unfortunate and introduction to standard healthcare in a lot of ways. Um, but I would say that, yeah, I mean, I kind of learned that sometimes you have to do what needs to be done and you have to deal with it head on. And those are really good life lessons. But I always felt like the disease was a bit of an internal stress meter for me, that I learned to listen to the messages of the body. Um, and I think that that's been critically important to me as I've gone through my life, because I think a lot of people take advantage of their health, or just they assume their health. They assume a certain level of well-being. And for people with chronic illness, as sort of professional patients, as I refer to us, um, that's never a given. And so we have to really focus on what we're eating, how we're feeling, the limits that we might have, and where those edges are. And I would say that the positives of it, I took away a lot of positives, that I learned those lessons early. And I feel like a lot of those things have followed through in my life. So it was challenging, but I had good supportive family members, and I was blessed with access to good healthcare, which is not available to everyone. So I was able to navigate it and continue to navigate it as part of who I am.
And also, it feels like you learnt the importance of diet and those, as you say, those edges where we all have, and everyone's edges are slightly different. You learnt that very, very early. And yes, you've Crohn's disease, but surely those lessons have stood to you even today.
Oh, absolutely. And that interplay between the learning that I was doing, which I was blessed to do through my publishing work, looking at the different herbalists that I'd worked with, Matthew Wood and a number of others, looking at the understanding the energetics of herbs and the energetics of nutrition. And and what's interesting is that I was quite young at 11 when it really manifested and I had my first surgery. And the experience of healthcare has evolved so much over time. From back then, I would see a gastroenterologist and they would actually examine me. They would palpate my belly. They would look off into space as they felt in my gut what was going on with their hands. And now, and what I saw evolve over time was that it went from that, and that asking me how I'm really feeling, and kind of being there with me very closely somatically. It's now evolved into where I see gastroenterologist across a desk, or across Zoom, as it were, and and we talk about numbers on the screen, from test results, from blood work or other diagnostics, and and then pharmaceuticals or other procedures are prescribed. And so it's changed a lot from that, but I think I'm lucky that I'm of a certain age that I was able to have that underpinning of understanding kind of a body, mind, spirit, was informed from the publishing and from my own health journey. because I think a lot of people don't have that today because their experience of healthcare, say for my condition, has always been talking to the specialist across
Yeah.
the desk.
I feel like that experience you've had, both as you say, with Crohn's and then your work within the book world and the distribution world and publishing, actually was a beautiful complementary situation for you for a very long time because, as you say, you got to learn so much via work, which not a lot of people get that opportunity. We have to do all our learning on the side after our jobs, which can be exhausting.
Yeah, it's been a real blessing because it has exposed me to so many different perspectives, and it's been part of the work that I do. And especially as I moved from the distribution side into the publishing side, and actually working with authors as they develop manuscripts and vision where they want to go with things, that's been particularly exciting because it's into the more creative work of the messaging around these topics. And for me, it's always about the impact of the books that are put out. That's the intention, is to try to put out things that are important and impactful, especially if they shift a cultural narrative that is not healthy, is not in a positive direction. And yeah, it's been great, and it has continued to been a through line, and I continue to do publishing work as we're building CannaKeys, and they still are complementary to each other, which is really exciting. But and it is about education, and that's a lot of what we're trying to do at CannaKeys is ultimately is make people aware of information that's challenging, but to ultimately have that kind of impact in the cannabis healthcare space.
So, for the purpose of the listeners, will you explain what CannaKeys is and who is it for? Is it for patients, nurses, herbalists, doctors, the layperson? So, what is it and who have you designed it for?
Sure. Well, CannaKeys, the company, our goal is really to create platforms and services that serve a really broad community around cannabis and the endocannabinoid system. And there's a lot of different places that we're planning to go, really that cover that whole spectrum of health and mind body medicine. But the CannaKeys 360 platform is the first launch, and we were working on a couple of other different things. And we had my colleague Uwe Blesching had a rudimentary database of the science that we identified that we wanted to improve. So we were re-entering the studies of cannabis in the endocannabinoid system across into a new platform with a lot more data points that we'd be able to do a lot more with them that would ultimately inform a lot of other platforms. But the two largest cannabis nurses groups, American Cannabis Nurses Association and CNN Cannabis Nurses Network, they got wind through our kind of allied and network that we had these that we were rebuilding this database because they were identifying in their committees and in their discussions and internally that they needed better access to the science. And so it was at that point where we pivoted to create the CannaKeys 360, which is a complete view of the science of cannabis and the endocannabinoid system. Because there's a lot of talk all over the world about the state of the science of cannabis. And it's spoken to make a point about healthcare or make a point about cannabis policy or to make a point about education. And unfortunately, it's been elusive as a concept because the state of the science right now is you search some of the databases and you get presented with a bunch of study links and you have to go through them yourself if you're going to glean any insights from them. And so what we identified was we needed some foundational information to support and really accelerate what cannabis healthcare is doing, what policymakers are doing, and what other folks are doing in the space. So the CannaKeys 360 platform presents the science through searches on medical condition, cannabinoid, terpene, and organ system, and provides dashboard insights, study lists, and everything is fully filterable to focus in on just what you want. If you want to see just the clinical studies for CBD for Crohn's disease, that's a couple of clicks, and you can see the dashboard output there. And really, who it's for, first and foremost, is for healthcare because there are tens of millions of patients in this country, in the US, that are on the sidelines because they either don't have the information, they've been impacted by the messaging of the war on drugs here in the States, and they're waiting for their healthcare provider. The two largest cannabis cannabis nurses groups, American Cannabis Nurses Association and CNN, Cannabis Nurses Network, they got wind through our, kind of allied and network, that we had these that we were rebuilding this database because they were identifying in their committees and in their discussions and internally that they needed that. They needed better access to the science. And so it was at that point where we pivoted to create the CannaKeys 360, which is a complete view of the science of cannabis and the endocannabinoid system. Because there's a lot of talk all over the world about the state of the science of cannabis, and it's spoken to make a point about healthcare, or make a point about cannabis policy, or to make a point about education. And unfortunately, it's been elusive as a concept, or the synthesis of all of them, how they work together. And so that's we've gotten, we have a couple of our educator partners who send us these great, comments from their students about how the platform has been so helpful to them, because it allows them to have the confidence to work with their patients as they come out as caregivers or as nurses, and do it in a way that is quick and they feel like they've seen everything they need to see. And lastly, the third group that we're really been working with is our policy folks who are influencing the legislation, like Americans for Safe Access and Patients Out of Time, because there's a lot of talk. I've done some lobbying work at the state capitol here in California, and there's a lot of talk about the state of the science. And the prohibitionist argument is that there is not enough, or it's too spotty. But and the other side argues that there is science, but it was always, kind of an amorphous and vague argument. And so to get the definition of that, and there are places where there are plenty of gaps in the science, and we desperately need more, but we need to be able to, if we're really going to support patients, which is at the end of the day what it's about, we need to be able to cut through that argument that's just this unending circular argument, and get back to where we're focusing on what do we know now, and also what are the gaps that, researchers who are also interested in the platform can identify promising research pathways, and also the gaps that might need to be filled with other evidence, including clinical.
So let's talk about that research for a second. So that's amazing, and I'm so glad I asked you that question, and I didn't try to butcher explaining what the CannaKeys was. So thank you for that.
Sure.
Um, and I understand why the nurses want it. I understand why it's so important for the educators, and I also understand that the layperson waiting for their medical professional to come to them with that knowledge is a very long road, because it's still only being taught in between 17 to 23% of medical institutions in North America. So, and it's an optional, endocannabinoid science is an optional module. It's not part of your medical curriculum. It's not essential. So, and I would understand why a lot of medical students choose not to take it, because they've enough to learn without learning something that's so brand new. You know, it's only 30 years old, which is very new for medical science. But the concern then is, if you're waiting on your medical profession to come to you with the answers and the information you need, you could be waiting a very long time, which is why so many people now rely on dispensaries or organizations like Leaf 411, which is a nursing organization, which is super helpful. It's a hotline.
Yep. And
Those
we work with
those kind
them.
of Yeah, those kind of organizations are vital at the minute, because it will be a long time before we have a the majority of our medical professionals are informed in a way that then can help with their patients. And also regulation needs to come streamlined, all of those things. There's a process here. It's going to take a minute to get this all done. So having the research there, which I always find is essentially important. We always say that without the armor, we can't move forward in this industry. And the armor is the evidence. We need that evidence to move forward. Is there any particular area of research that you found while building CannaKeys that is the one place where you feel cannabis is starting to prove as being, like, based on evidence, is starting to prove as being most helpful?
Yeah, it's a great question. There are certainly some areas that the science is very well developed, and that's one of the things that we like to show very clearly in our outputs of the dashboards, that you can see if there are clinical studies or not, or if there's only lab or animal studies, which are the lower level studies as far as quality, at least for how the mechanisms might work for a human. And so it is true that it's going to take a while and that we do need to get healthcare in, but it is, I'll just say before I get to your question, that it's great to see a lot of schools that are teaching, quote unquote lay people, but who are passionate about cannabis healthcare, and that there actually is the space. We do have a space right now before it's subsumed into healthcare, which I believe it ultimately will be, and hopefully in the right way, which is a thing that we're very, keen to see. But there's a lot of lay people doing caregiver work who are coming out of their schools and doing cannabis support, because the patients are often leading the way. They're making the demands on the doctors, as you said. And so they want to know, can cannabis support me for my condition or conditions? And so, yeah, we do need that quick access to the science and at least understand what science tells us before we get into the patient trends. And I would say, to your question, the one condition or area of conditions that comes to mind are the epileptic conditions, like epilepsy and Lennox-Gastaut and Dravet syndrome. There's a lot of studies that have been done and a lot of clinical studies, and many of them have been funded by GW Pharmaceuticals in the UK with Sativex, the Biximols, and the chemotype 2 even ratio THC and CBD sublingual sprays. Um, but I've also witnessed firsthand friends who are in the compassion space that I've interacted with their own children and children in the networks of compassion networks who've had incredible results. I mean, just like night and day results. And you see them on the news that these kids' lives are changed by engaging not only with cannabis, but dialing in and getting the right ratios and the right doses and the right forms of administration. And that's really, I think, what the cannabis industry is challenged with right now, because there's a lot. The recreational space is very strong. Obviously, the cannabis culture has been around in California for a long time, but we need to get to the point where we've got that guidance. And I celebrate it wherever it comes from, whether it's a nurse or a doctor or a caregiver who is some of the most uh, advanced, caregivers of patients I know of are lay people, and they have been working with patients, supporting them for a long time, and trying to bring that, loop the patient's doctors in. And for a variety of reasons, it's still challenging, but that's definitely one of the areas where things have progressed. But there are some exciting other ones too. I mean, there's um, a lot of different, not only pain broadly, but dialing in the different types of pain, like chronic pain and acute pain. Um, there's definitely different approaches there. And as we dial that in and understand the other impacts of different ratio levels of the cannabinoids, primary cannabinoids, um, we're learning a lot more. And the science continues to help us be more prescriptive with how cannabis is applied.
Are you getting more and more research as you develop CannaKeys, or is the research coming slowly?
It is advancing quickly. It is advancing very quickly. And that's really exciting to see. But the research is very broad. Like, I think some people have an assumption that the research is, people taking cannabis and we're seeing the results. But it's such a wide spectrum. There are more clinical studies, or sadly they're not really being done in the States very much because of our, legal framework as it still is. But globally, in a lot of different places, there's some really excellent science being done. But there's also, once we understand the mechanisms of the endocannabinoid system in the body, there's a lot of work to be done there about the interplay between the receptor sites, the different ligands and neurotransmitters that are happening, and then of our own endogenous or internal cannabinoids, particularly anandamide and 2-AG, the most prominent ones, and then the inputs of phytocannabinoids like cannabis, but also other things that we eat, fruit and vegetables that have terpenes and some cannabinoid receptor agonists or antagonists. There's a lot of prescriptive things we can learn. We like to talk about internally about how prescriptive we can be as things go forward, even understanding this is an individualized medicine. But if we can start to dial in the impacts and effects of different what one's endocannabinoid tone is, and how to how to work with that, applying different external and also internal impacts with some mind body techniques to influence our anandamide levels and our other endocannabinoid levels. There's some really interesting research in that space as well coming out. So it's exciting to see how fast it's expanding, but we've added more folks, nurses and a doctor to help us keep up with the science. But we're adding 40 to 50 studies almost weekly to the database. So that's part of what we feel our value proposition is to the greater global community of endocannabinoid healthcare, is to keep up with the science so everybody can do the teaching and the patient care and focus on that and focus on what they do.
So you touched on my next question actually, and this has kind of become an area of obsession for me, and that's individualized personalized medicine. Um, and we can get into that in great detail. And I have me and Dr. Ethan talk about it quite often, and then we every so often bring it onto the podcast. But how is Canada? Are you in a position to address that, or is that something that you're hoping the science will start to direct us towards?
Whether or not individualized healthcare is really something to be focused on.
Yes. So sorry, let me rephrase that question. I'm gonna assume that we're in the same place. I'm in a place where I feel individualized personalized medicine is the future. And I think cannabis is supercharging that movement forward. And I think if we didn't have, and I think then cannabis is going to bring loads of other botanicals into this space that were never considered previously. So yes, us, plant enthusiasts have been using it for years in this manner, and shamans have been using it for years, and the indigenous people who, worked with these plants all of their lives for generations and generations, and that's how they've worked with them. So for us, when people talk about individualized medicine, we're like, yeah, we do that. We just don't call it that. And I think that cannabis has is potentially, and maybe I'm being very romantic, Doug, but I think cannabis is potentially going to be that bridging gap between pharmaceuticals and healthcare and our botanical world and our phytochemicals that are so incredibly therapeutic if we just understood how they work inside our body. But we are starting to understand that because of cannabinoids and the endocannabinoid system. Am I being romantic, or do you see that as becoming a reality?
I agree with you. I don't think you're being a romantic, because I think what it's doing is the demand for science and the demand for understanding cannabis healthcare and our how our endocannabinoid system functions requires us to understand not only individualized medicine and the individualized results, that different patients see, but also the nature of integrative healthcare. And that's what's really exciting to me, because I think what it forces and this is going to be, I think, the real tension between healthcare and cannabis healthcare, is that standard American healthcare, I think standard healthcare globally, is it gets siloed, and the different specialties. And and the challenge with that is, and as I've experienced in my own healthcare journey, is it's challenging to talk to one specialist about one thing that's going on and another doctor about another aspect, when you know that there's interplay between those two conditions. And you need someone, kind of a next level healer, to help you integrate and understand what's going on and get on the best healing path possible. And I think what cannabis is doing, it has the increased potential to do, is to it's really a system that the endocannabinoid system, the science is showing us that it's integrating and connecting with so many other systems in our body. So as we understand more and more about how it works, it points us in an integrative direction. And the challenge with the science, the pharmaceutical companies, they're watching the space, closely. Obviously, GW, some other players are already in the space. And so what they're going to want to do is find out what cannabis pill works for Crohn's. And that's unfortunately not how this medicine works. But the science does give us some starting points for a patient. Where do I start? How do I get into it? And the science can show some direction to that. But we need to get the patient trends in there as well to tell a more complete picture. And it's nice to see on the boards and chat rooms, patients are talking to each other.
Yes.
Um, and ultimately, there's a starting place for people to say, all right, we'll try here, depending on the experience they want to have and what the science and patient trends are saying. But then ultimately, they have to gauge It requires the patient then to step out of the passive patient mode where they're taking the prescribed pharmaceutical for their condition and really listening to the message of their body, paying attention to the experience that they're having, and being mindful of the other things that are revolving around them, the stresses of their life, their diet, lifestyle. And it requires a holistic and really integrative approach to not just dealing with your condition, it's ultimately dealing with how you live your life day to day.
Yeah, I am. I used to be allergic to the word wellness. And
Mm,
I've had to fall back in love with it to an extent in the last few years because that is what it is. We have to work on our wellness journey or our wellness routine in order to have a mindset of preventative medicine. Because that's one of the things cannabis has taught me. Because I have seen patients come to me, Doug, and cannabis is the only thing that's a solution. But then
mm,
once you get past the acute problem, there is still a human, holistic being that needs treated for the rest of their life and whatever that is. And for some people, when you tackle the acute problem, let's say it's, anxiety attacks due to, overwhelm and stress, they might make the choice that they're not going to change the factor that's causing that stress. Let's say it's their job or their marriage. That's not going to change. They've made a decision for whatever reason. So then you have to rely on lifestyle choices around that core problem to make sure that anxiety attacks don't come back or that they don't get panic attacks again. And I found the plants, when you work with someone on a prescriptive model and consider them as holistic beings, which we do innately as plant workers, then you've so much more success long term than just relying on a pharmaceutical to fix the acute problem, because the acute problem is just a symptom. It's not the
yeah.
actual holistic problem.
Yeah, it's not a dual problem. It's not a dualistic problem that you fix the thing and then suddenly you tip into wellness, you tip into homeostasis. It's a spectrum. And if someone is dealing with such an acute issue that they need to bring in pharmaceuticals, that might be what's called for in that moment. But there is and there needs to be, and this is, a lot of people understand this in the space, is that cannabis is the off ramp for a pharmaceutical regimen, that it can be that, especially if it's dialed in well, so that results are there with proper dosing and forms of administration, especially. And so if one can do that, that spectrum can continue. Where, what I like to think about is, and Uva and I talk about this all the time, is one can actually move away from even external inputs and you can continue to work on with your endocannabinoid system based on the emerging science, where you're doing breath work or movement forms and getting body work done or doing yoga, um, and doing meditation. Those things impact your endocannabinoids that interact with your endocannabinoid system and interact, as we're seeing in the science, with external phytocannabinoids like THC or CBD. So there's really intriguing information there, but patients do need to step back and understand a holistic approach to dealing with what their challenges are, and they may find some of the solutions, are pretty embedded in their experience and could go back many years, and that work never really stops. And I think I talked to a lot of patients who, yeah, that's their experience. Once they started on a healing path that they felt was getting them somewhere, it's because they had expanded their view to really look at their whole experience as a person.
Well, people with wisdom do say the most important journey we'll ever do is the internal one, the journey inwards.
Oh yeah, that's for
Mm.
sure.
Let me ask you one more question before I let you get back to your life. You mentioned just previously that cannabis medicine is not straightforward in that the chemistry is different, the chemovars are different. It's not as simple as cocodamol or paracetamol, and they will always remain different. And this is one of the greatest challenges that I've had to face working in the cannabis space in Canada and North America, trying to explain to investors and CEOs and pharmaceutical heads that our plants will change depending on the rainfall, the harvest, the mood of the farmer. Like every energetic and environmental factor will influence the final chemistry of that harvest. No matter how it's cultivated, what it is cultivated for, no matter what levels of THC we want to gain from that and how that has been worked very technically in a greenhouse, when it is even grown in-house or outdoors, it will give a slightly different chemistry every time. And for a lot of people, that is an alien concept. And that is a point of massive contention where they want just this to be streamlined and they want to adulterate it so that it's harvested all the time. And we've had this experience in the aromatherapy world where huge companies will adulterate the essential oils so that their chemistry is consistent every time, which there's millions of reasons why that's a disastrous idea, but that's a whole other podcast. But that does happen, and there's people happy with that because it's controllable. It's
Yeah.
we can control it. Cannabis medicine, when left alone to do what it's meant to do, should not be controllable. Do you think this is something that the world as a whole, especially in the industry with the C-level people that run this world or are starting to run this world, even though we're patient led, are they going to get used to that? And is that going to become comfortable for the patients, or is that going to be something we're always going to struggle to communicate and to find to have it accepted?
This is a tricky one, and I do think it's going to be a long struggle because I mean, just look at the first, THC product really that was prominent here in Marinol, which is just a isolate THC pill of 100 milligrams. I
It's a
mean,
controlled cannabinoid.
it's a bludgeon. It's that's a serious dose. And so, I mean, I believe as close as you can get to the plant as possible is where we need to be, retaining all, not only the cannabinoids and terpenes, but the flavonoids and all the various things that we don't even have the science yet to really understand how a whole plant continues to show better results in studies than isolate. But the challenge is that the science is also showing us that, for example, various conditions, including Crohn's, that higher dose of some cannabinoids is really where you get efficacy. And so to try to get to the doses that I would need of CBD in the proper ratios to THC, I'd have to take a heck of a lot of plant material to do that if I could even do it, and be healthy doing it. And so I think there is a tension between understanding what the goals are. If it's an acute goal that you need to, tamp down serious inflammation, damaging inflammation, for example, in a part of the body, well, you might have to take something that's a little more processed to get to the dose. So you might be a little further from the plant than is ideal, but if you need to get certain compounds and certain ratios, yeah, you might need to do that. But again, it's sort of that spectrum where you're moving from an acute situation to a more one that's in where you're in homeostasis, where you're in balance. And just
And you're
like
seeking to balance that equilibrium long term.
that's what the goal is all the time. And our body does this. If we're cold, we feel that our body tells us that message, and we put on a jacket or a sweater. Our body is constantly searching for homeostasis and sending us messages that we're out of balance. And so whatever therapy we might need, our body is telling us a lot of those messages. Unfortunately, many of us ignore those messages, and I'm still trying to learn those messages to this
Yeah,
day.
that's a life
But so
lesson.
I think that, yeah, the closer that we can get to the gentler and whole plant inputs that are external, the better, because and then working internally with ourselves, will make us just a more receptive body for those external inputs to do their job.
Yeah, I think that's exactly right, Doug, and that makes so much sense. I'm interested to see how this is all going to evolve. I think because it's so patient led and it's been in the patient's hands for decades, even when it wasn't legal, it'll never become something that's controlled by pharmaceuticals. I think that ship has long sailed, but it is going to be interesting to see how the pharmaceutical world carves out its place with cannabis medicine.
I think there's a key opportunity that there's a space between the standard healthcare model and the dispensary model, more or less as it exists today. And there's definitely starting to talk with dispensaries. It's another area that it's great to hear from dispensaries and dispensary groups who want education in their retail spaces, which is fantastic. But
Oh,
there's an
there's so much more of
opportunity.
that happening now. I see that all the time. Like,
Yeah, and I think that's a result of everyone doing educational work to make people aware of the possibilities. But I think there's a space that needs to happen that is a bit of a middle ground between healthcare as we kind of know it now and the dispensary experience, which is a bit more like a clinical, like a clinic model of dispensary that ideally would also incorporate mind, body, and other aspects of wellness, whether it's essential oils therapy or other herbs alongside cannabis, just something that allows people to find where their condition needs to be treated on the spectrum, and then applying the right thing and moving them toward fewer and fewer inputs where they're achieving homeostasis. I think that wellness clinic model that incorporates cannabis in the right way, in a framework of as whole plant as possible as far as the medicine goes, but understanding that certain numbers of dose need to be achieved because that's what the science is telling us, and that's what patient experience is telling us. I think there's great opportunities there, and if someone achieves that, I think ultimately as education continues and the consumers, the patients, continue to educate themselves, we wanted to build CannaKeys 360 in a way that also spoke to lay people and patients. And we love it when they dip in and maybe they'll subscribe for a month or even just do the free 7 days up front and learn what they need to know about their condition, and then they go on without a subscription, which is fine. We want to have some influence there and have people at least understand the starting places. But I think there is a strong opportunities for healthcare if they can do this right and create models that are a little bit differentiated from the dispensary models that are recreationally focused. But let's be honest, that a lot of that is it's already a wellness space, the recreational space in many ways. So I think there's opportunity there, and I think the cannabis I agree with you for the most part that cannabis is going to force this issue, and that it's going to be hard to put the genie back in the bottle since it's
Oh, I think
out.
the genie's out, Doug. I don't
Yeah.
think the genie's going back in. I think
Yeah. I don't
that
think so
ship's
either.
gone. That's the way to
Yeah.
see.
Yeah.
Doug, it's been fascinating picking your brains. I'm probably going to torture you in about another 6 to 12 months to see, I can only imagine where you're going to take CannaKeys and what industries it's going to get into. I see it becoming very layperson as well, because even when I speak to lay people, they're asking me for science on cannabis when I've never been asked for science on essential oils. So I think that lay need is going to be something that you guys are definitely going to be able to serve. Thank you for your time and thank you for everything you do for us. And I will link to CannaKeys and link to your work. So if anyone wants to reach out to you directly, they can do that.
That'd be fantastic. Colleen, thanks so much for the time, and thanks for everything you do at LabAroma to educate the communities. Thanks so much. Appreciate it.
It's my pleasure. Have a lovely day.
Thank you.
Bye. I hope you really enjoyed today's interview. I know I definitely enjoyed this episode of the podcast. The work the guys are doing at CannaKeys is fascinating, but Doug's insights into that whole personalised medicine and the role cannabis could play in it is super interesting. If you enjoyed this week's episode, you can rate and review the LabAroma podcast over on iTunes, Spotify and Google Podcast. And don't hesitate to share this episode with friends and family or colleagues who might be interested in this topic. Until next time, take very good care of yourselves.